Hello, this is Seizures to Semiology presented by the SchrDbb with reference a practical guide to issue taking and clinical examination by Anwar Qais Saadoon. So seizure is a transient neurologic event resulting from abnormal excessive synchronous neuronal activity in the brain. So when you have abnormal impulse transmission in the brain, so it's going to be result to seizure. So you have transient neurologic event resulting from abnormal excessive synchronous neuronal activity in the brain. Now, what's an epilepsy? An epilepsy now is a chronic neurologic disorder which is characterized by seizures. And now the practical definition of an epilepsy is when you have so a practical definition of an epilepsy is when you have 2 or more recurrent seizures within 24 hours. You have one seizure with with a high risk of developing another seizures, or you have a epileptic syndrome. All that's the definition of an epilepsy. So we have 2 or more unprovoked seizures within 24 hours. So we have a status epilepticus now is defined by McCarthy and Hani as a continuous seizure activity or recurrent seizure activity without gain of consciousness, so lasting for more than 5 minutes. So if you have a continuous seizure activity for more than 5 minutes in older children and adults, is going to be status epilepticus. But if it is more than 15 minutes in unit, is status epilepticus. So seizures may be classified in, so you have generalized, you have focal or partial, you have epilepsy syndrome. Those are the classification of seizures. So generalized, when the whole cortex, they see the stimulation of the whole cortex, consciousness is usually impaired. You have focal, when there's only one area of the cortex which is affected, there may be, so it may become generalized, and here with focal, your consciousness may be preserved. You have epilepsy syndrome. So epilepsy syndrome generally, so epilepsy syndrome which are symptomatic, idiopathic or cryptogenic. For more details about the various type of seizures, a detailed history is indispensable in initial assessment of child with seizures. So now you have the type of seizures. The type of seizures, you can either have a clonic seizure, tonic-clonic seizure, atonic seizure, myoclonic seizure, or so the seizures can first divide into motor, generalized or focal seizure first divided into motor and non-motor seizure. Motor seizure are tonic, clonic, myoclonic, atonic seizures, and then the non-motor seizures are forming the absent seizures. So you have now generalized tonic-clonic. So here the child falls in the ground in response with eye deviating or blinking. Here is a generalized stiffness is tonic, and clonic is generalized moving, jerking of the other limbs. So stiffness is tonic, and jerking of the limbs is clonic. So arrhythmic jerking of the movement of the limbs. You may have incontinence of urines or stools. There is post-ictal phase after this seizure, and the tonic phase usually stays for 10 minutes. The clonic phase is for 10 to 20 minutes, and then the post-ictal phase for 5 minutes. So the next one now is tonic seizure. No, this stays for 10 seconds. Tonic phase usually stays for 10 seconds, not 10 minutes, 10 seconds. The clonic phase usually stays for 10 to 20 seconds, and the atonic is staying for 5 minutes, and the post-ictal phase stays for 5 minutes. Now, tonic seizure is a brief seizure with a sudden onset of contraction, extensor muscles. Are you getting? That's just stiffness. Myoclonic seizure is a sudden brief seizure of less than 50 milliseconds. So a sudden brief seizure of less than 1 second, less than 50 milliseconds, involuntary contraction of the muscles and muscle group. So the contraction can be single or repetitive and are often regular. So this is very difficult to differentiate with a spasm. So now, but now with a spasm, it involve only one muscle group, but this you can involve multiple muscle group. Atonic seizure or drop attack. So this one can easily be confused now with a syncope. This characterized by postural tone movement, typically lasts brief for 1 to 2 seconds. You suddenly fall 1 to 2 seconds, actually with falls, and they may lead to facial injury. So it can be distinct, the differential to this can be a syncope. Now we have absence seizures. Absence seizures, they may occur in children and between 4 and 5 and 12 years of age. They may be typical and atypical absence with special features. The typical absence seizures are generalized seizures. You have typical absence seizures are generalized seizure consisting of abrupt onset of unresponsive, loss of awareness, staring, and eye floating. So you have it is divided. Absence seizure is divided into atypical and atypical. Atypical is mostly in children, while atypical is adolescent and adult. It's having a sudden onset. Typical is having a sudden onset and a sudden offset, while atypical has a late onset and late offset. We have also the next one, the duration of the typical. Typical usually less than 10 seconds, while atypical is more than 10 seconds. That's it. So often observed behaviors mass marking is usually brief, that's 2 to 15 seconds and 100 times per day. That's for typical. May be precipitated by hyperventilation 3 to 5 times per minute. So now we have for 3 to 5 minutes, so hyperventilation. So we have focal seizures now. Focal seizures now, we have, it can be partial, we have complex partial, and we have partial seizure with secondary generalized convulsion. So simple partial seizure, we have consciousness is not impaired with motor, tonic, clonic, myoclonic, sensory, visual, auditory, olfactory, gustatory, so somatosensory, anatomic, mixed symptoms. We have complex partial seizure, may be associated with impaired consciousness. So those are focal seizures. You have simple partial, no loss of consciousness, but it can be motor or non-motor. Non-motor now, non-motor or sensory have now visual. It has visual abnormality, auditory abnormality, olfactory abnormality, gustatory abnormality, vestiginous, so vestibulocochlear, vertigo abnormality, somatosensory abnormality. We have autonomic abnormality, and we have mixed symptoms. Complex partial seizure may be associated with impaired consciousness and automatism. Partial seizures with secondary generalized convulsion, that's the next one under focal seizure. Now we have epileptic syndromes, that's epileptic seizure spasms. The preferred term is infantile spasm because this occur beyond infancy. Can occur beyond infancy. The preferred term over infantile spasm, so it's epileptic spasm. So these occur in infant aged 3 months to 2 years. They consist of mixed flexion, extension of the proximal limb, that's the West syndrome. So less commonly extension of the truncal and extremity. Attack of epileptic spasm are numerous per day. They usually occur in cluster, either falling asleep and all that. Now febrile seizures, that's febrile convulsion. These occur in children with age of 6 months to 60 months, that's 6 months to 6 years. Associated with a temperature of 38 degrees Celsius with absence of central nervous system infection or metabolic imbalance. We have simple febrile convulsion. So it's divided into simple and complex febrile convulsion. Simple febrile convulsion are primarily generalized, usually tonic-clonic, brief, of less than 15 minutes and do not occur more than once a day. That's simple febrile convulsion. The child with the type of seizure, neurologic and development, there is no neurologic and developmental abnormality. While complex is usually focal, it is prolonged as longer than 15 minutes, repeated in same illness, so it can be repeated in a day and usually associated with developmental delay. So now we have seizures now, history. Identification, we have chief complaint, we have history of presenting illness, we have antecedents. So we have antecedent, what happened to the hours before the spell. We have context, have you seen it? So what happened immediately before the spells. So onset, so how did the spell start? Can the child tell when the episode will occur? That's the oral. Does the child remember the spell afterward? Describe as loss of consciousness. Describe the events. So tonic-clonic, chronic, and all that. How long did the events? So you can read now all what is inside here. Post-ictal fail, what's the duration of that? So now the next thing now is past history. You have the birth history, you have to speak about maternal diabetes, completed labor and all that. You have medication history, certain medication, antidepressants, stimulants, and so antidepressant is going to excite you, so stimulants, you have immunosuppressant antibiotic can prone you to seizures, developmental history, school delay, family issue of epilepsy, similar episode, migraine, tremors and all that, social issue of alcohol, drug addict and all that. So now key points: seizures in neonates should always raise the concern of an underlying cause. Seizure is in febrile context between 6 to 16 months. Febrile suggests febrile seizures. A focal seizure may suggest localized intracranial lesion. A focal seizure may suggest localized intracranial lesion. So early onset of seizure, vomiting, lethargy shows a metabolic. Early onset of seizure, vomiting and lethargy show a metabolic disorder. So vomiting, lethargy, seizure without any focal neurologic deficit, you and generalized seizure may think of metabolic disorder. The next, we have seizures associated with a recent headache, vomiting, lethargy, weakness, alteration may suggest central nervous system pathology or space occupying lesion. So if you have headache, vomiting, lethargy, weakness, all that for recent intracranial pressure, central nervous system pathology. So you say thanks for your kind attention.